Good afternoon, everyone, and welcome to the Modeling Speaker Series. My name is Jose Canevari. I work at the modeling team here at ECDC. I was told I should say that we are recording this session, so just in case you have any issues with that. Today, we're very, very happy to have Ellen Brooks Pollock as a speaker.
Good morning.
I think there's someone there that needs to, yeah, thank you. Ellen is a professor of infectious disease modeling at the Bristol Medical School, University of Bristol. Is that right? You used to be at the veterinary school, right?
Yeah, I've moved around different departments.
Yeah, moved around,
yeah, I've been in the vet school as well.
Yeah. Yeah, I've seen a lot of your work on modeling. Yeah, lots of work on that. But during the COVID-19 pandemic, Ellen was a regular contributor to SPY-M, a technical group providing modeling evidence to the UK government, a contribution for which she was awarded an OBE. And she's particularly interested in developing effective collaboration frameworks between modelers and policymakers. And I believe today's talk is a little bit about around that topic. So yeah, Ellen will be presenting on an ongoing project reviewing the challenges and benefits of modeling for policy and reporting on conclusions from a modeling in policy workshop to improve the processes by which modelers work alongside policy makers. So without further ado, I should pass the microphone to Ellen to start the presentation. If you have questions, you can either post them in the chat anytime, or please wait till the end of the talk, and then we can have a discussion. Right, Ellen, over to you.
Great, thank you very much, and thanks for inviting me to join this forum to talk about this modelling and policy work. And just to say, I mean, I'm happy to take questions during the talk if you like, and I especially, we welcome feedback on these principles for modelling and policy, because I know that I can see all the people who were joining, you all have loads of experience in doing this as well. So yeah, really welcome feedback on all of it. So you can see my slides okay. So the rough outline of what I wanted to talk to you about today is I talk a really little bit about where I came from and what my background is, talking about the role of scientific advice in decision making, particularly during the pandemic in the UK, and our particular experience during COVID. And then want to talk about this modelling and policy workshop, why we did it, and developing these principles for modelling and policy, which by virtue of me being involved with the thinking about these things, I found really useful in thinking about how I shape the research that we do, and we really hope that it will be useful for other people when thinking about how to conduct impactful modelling. So you probably know, but I just thought I'd go over the way scientific advice got into policy making, particularly during the pandemic. So at the kind of at the top of the tree, we have the UK government, the Cabinet Office, and we had a system called the Scientific Advisory Group for Emergencies, which is SAGE. And SAGE is an ad hoc organisation that's brought together during times of emergencies. So the membership is not fixed. It depends on what specific emergencies there are and what expertise are required. So during, and it was last called, pre-COVID, the last time it was operational was for flooding. So you can imagine you need different groups of expertise. It's chaired by, I'm assuming that you're sorting out the lobby. I can see lots of people popping up. I'm just going to ignore it, but if I need to stop, just call out. So it's chaired by our two most senior scientists within government, which are the government chief scientific advisor, who at the time was Patrick Vallance, is now Angela McLean, and the chief medical officer, Chris Whitty. They chair SAGE, and they review evidence and make recommendations and produce consensus statements. There are a number of different groups and advisory groups that feed into SAGE, and one of them is the Scientific Pandemic Influenza Group on Modelling. It's now changed to Infection Group on Modelling. And during the pandemic, it was changed to an operational word added to it. So it's usually called SPI-M, but during the pandemic, it was called SPI-MO. And this grew from a relatively small group of modelers to an enormous group of modelers. There were about 50 people, modelers, who are regularly contributing to SPI-MO across more than 7 universities. And here at the bottom, you can see, you'll probably, if you can squint, you might recognise some modelers that you work with. So this was a large group of UK modelers that were meeting on a regular basis, weekly, at least weekly, throughout the pandemic. So what did all of those people do? Because there were quite a lot of them. So one thing was, and so I've kind of divided it into 4 different areas that SPI-M contributed to. The UK government released on a weekly basis an official R number, an official growth rate, and these estimates were consensus estimates. So multiple modelling groups within SPI-M submitted an estimate, which were then combined statistically to give an overall latest estimate for the reproduction number and the growth rate. And this was produced throughout the pandemic. So we had someone, Rob Challen in Bristol, was using one different model to produce an estimate based on the latest data. So one big part of what SPI-M was doing was every week getting the latest data, making an estimate of the reproduction number, which was then combined to produce these official estimates. And there were multiple different types of model that went into those R numbers. So some people were using EpiEstim, others were using compartmental models, more complex models, but they were all combined and into this single official value. There was also short and medium term forecasts. So in a similar kind of way, multiple people submitted these short and medium term estimates of what might happen based on different types of models. Probably the most controversial and the part that attracted most criticism was scenario modelling. So looking at these what if scenarios, and the communication around this scenario modelling was tricky, because often these scenarios were interpreted as predictions, and then the tabloid news would grab hold of this scenario modelling and say, look, these models are absolutely rubbish, nothing like that actually happened. But we were told repeatedly that these scenario models are useful when trying to evaluate what kind of policy decisions would be made. And then finally, there were researcher-led contributions. So these weren't commissioned pieces of work, but if you'd done something and the Secretariat deemed that useful, that would then feed into SPI-M, and then depending on the SPI-M chairs and their decision, that would either that could make it into the consensus statements and then go on to be presented at SAGE as well. So just to say an early plug, well, not plug really, but so all these modelers were contributing to SPI-M, and we guest edited an issue of Proceedings B that contains 20 articles from all the different modelling groups, looking at how different modelling evidence that was used then and shaped policy. So as a kind of a little bit different to the normal modelling article or academic article, we asked people to also write a paragraph on how their particular modelling evidence had gone into policy or how it shaped policy. And we got input as well from the SPIAM Secretariat for the introduction article, which kind of describes generally how scientific evidence and modelling evidence was used during the pandemic. So before 2020, I did my PhD I finished my PhD in 2008, and my PhD was on bovine TB, using livestock movements to model the spread of bovine TB. And I'd been working in the Health Protection Research Unit since 2015, which seeks to link UKHSA, which is the UK Health Security Agency, as a government, an arm of the government, with academics and developing responsive work. This was a bit of work, an example that we'd done, looking at the epidemiological inference from TB cluster sizes in the UK, and we'd done that kind of at a slower rate than COVID research. And I also had a stint working at the London School of Hygiene and Tropical Medicine on flu survey, so I had some experience of developing surveys and interpreting data that came out of those kind of systems. So when COVID started, we were not commissioned to do any specific modelling, but Leon actually suggested, I think we could adapt one of the models that he previously had. He had a spatial model based on census data for the UK that had been used for flu and for smallpox. And so we set about adapting this model to use some COVID-like parameters. And this was, it was very simplistic, wasn't particularly accurate, apart from the thing that was useful. So the thing that was different about it compared to other models that were being used at the time was that it had some seasonality component. And the fact that we were looking at the impact of seasonality meant that we then invited to SPIAM and kind of got incorporated into what was happening at SPIAM and responding to policy questions that came up. And one of the first policy questions that came up once we were involved with SPIAM was looking at what impact gatherings and groups of individuals would have on the overall spread of COVID. So this is the kind of timeline. In March, the First Minister of Scotland announced that all gatherings over 500 people would be cancelled. This was pre-lockdown. And Boris Johnson announced that gatherings of a kind of unspecified size would be banned. Obviously, events overtook them because we then had a full-scale lockdown at the end of March. But the question arose, really, what impact would banning these kind of gatherings and groups, what impact would that have on the spread of COVID? So my PhD was in Warwick with Matt Keeling, and while I was there, Matt, with John Reed and Leon Dannon, had developed this social contact survey, which was similar to Polymod. But one big difference with Polymod, I now know Polymod and Comix has this question, but it had this extra question at the bottom. So here, this was what the form looked like. People had to fill in their individual contacts, details of their contacts, so where people met, did they touch, how far from home, how long was the contact, how often. So one difference was they also asked who met whom, so you could build up some kind of idea of clustering, but then they asked for groups of similar contacts. So if you went to church and met loads of people, rather than listing everyone, you could say, and I went to church and I met 100 people. Or if you were in a rugby team, you could say, and I had 11 contacts. And what that did was it allowed people to report their high numbers of contacts. And so it meant that in comparing what kind of contact you can see that the red squares are the distribution of contacts with groups. So it was really capturing the tail in more detail than other surveys. And on the left here, you can see an example of how groups were reported. So you can see this flight attendant. They had some work contacts, but then they were in contact with everybody that was on a plane. So these blue squares were passengers, and that would have been really difficult to report in a kind of standard contact survey where you're listing everyone. They probably didn't even know who all those individuals were, but they were able to say quite precisely, and I was on a flight with 300 people or 342 people. So we use this social contact data to construct individual reproduction numbers for people, so kind of representative population of the UK. So it's really simple. An individual reproduction number is just the number of people in a contact. So that's the group size. So you went to the pub with 3 people, N would be 3. The duration of a contact, and then we had some setting specific attack rate, which we actually incorporated later on. So essentially, an individual reproduction number was just some calibrating constant multiplied by their numbers of contacts. And you can see here on the right, this is what the distribution of these individual reproduction numbers look like. So loads of people have had low reproduction numbers, and a few people, maybe like the flight attendant, had high reproduction numbers because they were in contact with a lot of people. So obviously we don't necessarily want to know what people's individual reproduction numbers are, but we can convert that to a population reproduction number, which is what we usually understand as the as R0 or R, by assuming something about how individuals make contact with other individuals. So if you assume that the chance of contacting someone is proportional to the number of contacts that you have, you get a very conveniently symmetric next generation matrix. And then taking the maximum eigenvalue, you end up that the population reproduction number is proportional to the squares of the individual reproduction number, the sum of the squares. So it's a really super simple model for relating individual contact patterns to the overall reproduction number. Now, kind of in the past, at the very beginning of COVID, so when we're talking about March 2020, obviously we're still estimating what this calibrating constant was. And so it was difficult. So we kind of took an alternative approach, and that was to bypass what the calibrating constant was and think about the population attributable fraction of groups to the overall epidemic. Now, the population attributable fraction you're probably familiar with was developed for non-communicable diseases. And these are some examples. So they say things like 80 to 90% of lung cancer deaths are due to smoking, or 16% of cardiovascular disease is due to hypertension. And what it's really saying is that if you look at, for example, deaths in smokers and non-smokers, if you took away some proportion of lung cancer cases in smokers would have happened anyway, just by the rate of the background rate of lung cancer, but there's some kind of excess number of cases that are due to smoking, and the population attributable fraction can be calculated from the increase in the relative risk time and the proportion of people who have that risk factor. So that's P would be the proportion of people that smoke, and R is the relative risk associated with those people. Now, just a little spoiler, the population attributable fraction for infectious diseases is not at all obvious, and this is sometimes how it's calculated. It's sometimes calculated by having a kind of standard compartmental model. You simulate what incidence is, with and without a particular risk factor, and then you look at all the cases that were prevented if you didn't, in the counterfactual scenario where no one had the risk factor. In some work back in 2017, Leon and I showed that this is not what you should do because it massively overestimates how important a risk factor is. And the reason is because if your reproduction number is close to 1, if you remove a risk factor, you're crossing this epidemic threshold and your long-term epidemic goes to 0. So if you just look at the change in incidence, you very quickly approach an estimate that every single risk factor has an attributable fraction of about 100%. So don't do that. It's complicated and don't do it. But what you can do is just look at the ratio of the reproduction numbers with and without your risk factor. So that's exactly what we did for groups. So essentially, we were able to use this social contact data and look at what the population reproduction number would be with and without groups. And we came up with these estimates. So we were able to say something about how the impact of groups of various sizes. And you can see that the population attributable fraction for groups over 100, for example, this is the graph on the left, is really tiny. So the fact is that groups of over 100 just happen so rarely that when you're thinking about kind of the impact of interventions, banning very large groups has really a very small overall impact on the epidemic. So that was fine. It was just a piece of work that had gone to SPI-M and was discussed. But what it really meant was we now had this tool for linking individual contact patterns to a population level reproduction number. So we have a person, they have all these contacts, and we know the context from the survey. So we know if it happened on a bus or in a bar or at school or work. And essentially we could switch on and off these social contacts. So we're relating changes in the individual reproduction numbers to the population reproduction number. And I spent a lot of the pandemic producing these kind of figures. So let me just talk you through what these figures are. So along the horizontal axis, the x-axis, this shows the percentage of work and leisure contacts that are active, are kind of switched on. And then up the vertical axis, the y-axis, that is the reproduction number. So it provided a really simple mapping between people's NPIs, non-pharmaceutical interventions, and reproduction numbers. And the different coloured ribbons are different school opening scenarios. So grey is all schools closed, turquoise is primary schools half open, yellow is primary schools completely open, and then red is all schools open. So I started doing this work. We had what they call a task and finish group on the role of children in transmission. And I was doing this, when I say I mean we, use the slip of the tongue. We were doing these estimates of the reproduction number based on this social contact patterns, and other groups, these other 4 groups, were looking at different kind of reopening scenarios, so how we could safely open schools. And one thing that became clear is whatever happened in schools, whether we went for this 50% or mornings and afternoons, was more or less irrelevant if you had lots of social contacts going on outside the school. So we found, adherence to wider social distancing practices was far more important than which pupils were in or out of school and whether you had morning classes or afternoon classes. And just a note about presenting at SPI-M, because there are so many models, it was like the most rapid peer review I've ever experienced. So you would present stuff, you'd have an enormous number of questions like, what did you assume about this? Why is that? Blah, can you justify this and that? And so, you presented, it was extremely academically rigorous, was my experience, and you ended up with an awful lot of homework where you had to go home, revise everything that you'd done. And Angela McLean, who was the co-chair of SPIAM, was really instrumental in changing this initial figure that I had done into something that was really useful for policy. So, for example, they said you need to reverse the axis, the ribbons need to be sequential, so you can think about opening one, like having primary schools open and secondary schools rather than separately. You include all these other things like contact tracing, COVID security, include the emerging evidence about the reduced susceptibility of children. So we went through these very rapid revisions. And one of the big revisions was validating with alternative data. So Edwin from UKHSA and Petra using BBC data, we together, or kind of independently, reproduced these figures to show what it would look like if we use different types of social contact data as their underlying assumptions. You can see here that was a result of that exercise. So yeah, just here, this is kind of what this figure looked like. So on the left, we have full lockdown. So that's where 100% of, on the left is full lockdown. That's where there are no active work and leisure contacts active at all. And then on the right, that's normal behaviour. That's where everyone just has their normal social contacts. At the start of the pandemic, the reproduction number was about 3. So that's, if you look at the red ribbon, that's where all schools are open, everyone has their normal contacts. That kind of defines what the calibrating constant is. And then in April 2020, we were down here. So around 80% of people's normal social contacts were not occurring. Schools were closed, and we had a reproduction number of about 0.7. So the question that was being asked in April 2020 was, can schools reopen? And so from this Ready Reckoners figure, what you would do is you would move up into this yellow primary area, and that would suggest that the reproduction number would still be below 1, even with all primary schools open. But if we open secondaries again, that would then take us into this realm of having a reproduction number of bigger than 1. But of course, if you introduced other measures like COVID security and contact tracing, we could then scale down all of these transmission rates, and we could actually safely open schools. So we'd be in this red ribbon, still below 0. And essentially, these kind of figures were used by SAGE and used by science advisors to communicate the choices that could be made in reinstating NPIs and reopening, kind of coming out of lockdown. So you start in the upper panel here, have this full-on lockdown, and then you want to exit lockdown. So how do you traverse these figures to get to a place of kind of safe operation? And this is a picture here from Angela that she sent me, where she was using these kind of figures to understand the trade-offs between different interventions and how you might exit lockdown. So, obviously when we started doing this work, we did it for gatherings and groups, and we really didn't foresee the utility of this work, and it was really shaped by Angela and shaped by the Secretariat into something that was needed by, so the Department of Education used it a lot, Cabinet Office used it, but why in particular was this modelling work useful and every other bit of modelling work not so useful? So we started thinking more generally about what makes models useful for policy, and Chris Whitty has kind of summarised it, and he's summarised the challenge. He said one of the big differences for modelling rather than general scientific evidence is that people often respond to models in two ways. They either love them and overbelieve them, or underbelieve them and are just absolute skeptics, won't believe models at all. And that's a big challenge when using modelling for policy. So as was said in the intro, we co-developed this modelling for policy workshop to try and really understand how we can make modelling intentionally more useful for policy making. So we had this workshop in July 2023, and we had various topics that we tried to shed some light on. So they were visualization, the language that was used, uncertainty, and then how you go about condensing information. And we wanted not just epidemic modelers, but we did have epidemic modelers, but we also invited people from who worked in transport modelling and climate modelling, and also AI, people involved in AI, and then also civil servants throughout the UK government. So it was co-organised with the Cabinet Office, but we had ONS there, and Education, Department for Education, and Devolved Nations as well as the Scientific Secretariat, who are really key. So for the rest of my talk, we have spent a lot of time debating what we think some principles are, and I'm going to go through them, and it would be brilliant to hear people's feedback and a response to what we think. So first thing that came up was this idea of influencing the influencers. So you often think that you need to be in a room with a minister to have an impact on policy, but ministers are often very short of time. They might not have a scientific background, and so it might be difficult to actually be involved directly with ministers. But the Scientific Secretariat and Scientific Civil Service are the people who work day in, day out with ministers and are able to use your results to communicate in an appropriate way to the people who are making decisions. So often the relationships that you want to build are not with ministers, they're with the people they're with the influencers, they're with the people who work with ministers. So you're one step away. And they're often very well qualified, they have scientific backgrounds, and it's much easier. They understand the value with those people. Making those people your key contact is often much more valuable than going to the education minister, for example. And building those relationships is not necessarily a great time to do it in times of emergency. And one of the things that we did in our introduction article for the Phil Trans B special issue is we mapped out the contributors to SPI-M and where people had pre-existing publications. So these were all the lines are, so each dot is someone who was contributing to SPI-M. Different colours are the different groups, and the lines are shared publications pre-COVID. So you can see that these relationships were already extremely well established prior to COVID, and it would have been really difficult to start working in this responsive emergency mode if you really had just met someone and weren't aware of their background and their expertise. So secondly, you need to understand what individuals' motivations are. So Angela put it as state the blindingly obvious. It's not just because you think something's obvious doesn't mean that other people think it's obvious, and it could still be extremely useful. And we spent quite a lot of time discussing potentially divergent motivations. So academic impact is not the same, and academic reward is not the same as policy reward. And a professor of AI at the University of Bristol described it in terms of doctrine. So doctrine is a military term relied upon for as a consensual set of tools that help guide action. So policy benefits from doctrine, but scientists going with the status quo is not what their bread and butter is. So scientists are incentivized to do new and novel things, which is not necessarily what's useful for policy. So there's different motivations and different reward systems, and acknowledging that and understanding how you can come to a kind of agreement that benefits both sides is a really useful thing to do early on. Third kind of principle that we discussed is working within the window of influence, as was described. So, as I'm sure you all know, academic timescales are extremely different to government timescales. And Chris Whitty had in his 2015 paper about making policy impact that an 80% right model is better than before a policy decision is made, is better than a 100% right model after the decision. And you can understand how that's true, but that is very difficult for scientists to kind of work with, because you don't want to share results that you're not 100% sure about. So you have to start feeling comfortable with what you can say and what you can't say, and making sure you do it in a timely way. Especially during the pandemic, peer-reviewed manuscripts are often preferred, but might not always be an option. So using preprints was really relied upon during the pandemic, and getting things out and kind of early versions published was hugely valuable. And then one thing that I think is also really valuable when working with policymakers is being reliable. So if you say that you're going to deliver something by a certain date, make sure that you do it, because if you don't, then you won't be asked to do something again. So you have to kind of demonstrate your reliability. Fourth one, discussion point that we had was striking a balance between certainty and limitations. So it would be wrong to overpromise capabilities of a model, and you have to obviously recognise the boundaries of your expertise. As a professor in infectious disease modelling, I shouldn't necessarily, or shouldn't at all, offer my opinion on the use of filters, for example, in schools. So just being aware of things you can give your opinion on and things you can't. And also be aware of jargon and how that might be interpreted. So we discussed language like reference scenario and base case, and we thought about the benefits. So my feeling was one of the advantages, one of the good things about the Ready Reckoners was the fact that we decided quite early on to remove the mean line. So we just had a shaded region. And it's a bit like the Bank of England's fan charts. So they have these fan charts, and they have a little explainer with how to interpret them. So not having a single line can be hugely useful for avoiding an over-reliance on a single answer. One of the things that really came out from the policymakers that we were working with is that it's really important to be able to allow your results to be tested and explored. Often we produce figures and they're kind of fixed figures, and it's really difficult for people who are working with policy to understand what the different factors are that go into making those results. So Chris Whitty in his 2015 paper again really advocates the use of interactive tools so that people can really explore and start to understand what the factors are that go into making to leading to your results. And it's really important that people that don't have to blindly believe what your outputs are. So the results need to be accessible and also comprehensible. One of the things that we discussed is allowing these influencers to extract model results and replot them in a way that's more appropriate. So the results that you have shown are not necessarily the optimal visualizations, and allow other people to visualize some of your results in a way that might be more impactful for people making decisions. And we discussed a lot about visualizations and making them look professional and having a consistent formatting. So if every time you produce a new figure, it's a completely different figure, and people take a while to adjust to these new figures. So unless you really have to introduce a new style of plot, stick with things that people know how to interpret. So often, it was suggested that you should only ever have time on the x-axis, because people are so used to looking at those kind of figures. But that, I don't think that's necessarily the case, but make sure that you're not chopping and changing all the time. And lastly, our last kind of take-home message was that you have to be flexible with your knowledge. So don't overstep the boundaries, but either you're an academic working in a particular field and you've got a long-standing specialism, which all of a sudden becomes very relevant. But most people weren't experts on COVID at the beginning of the pandemic. So you have to learn to adapt your expertise to different situations and be prepared to learn quickly. So that's the end of what I wanted to talk to you about. And I would we're really up for feedback and discussion, and anything that we've really missed, please tell us about. So yeah, just in summary, modelling for policy is different to modelling for research, but it can be hugely rewarding and interesting, and it's just a question of kind of altering your viewpoint and ways of measuring impact. And yeah, we're at the Plus team in Cambridge to develop these principles for making modelling more impactful for policy. Over and out.
Wonderful. Thank you, Ellen. That was great. I really enjoyed it. I loved how you went through, covering things at different levels, from the methodological things to, real life experiences working in the COVID-19 response, and further thoughts on lessons learned, and what can we do to improve interaction with policymakers from the modelling side. We have a question from Philip. Philip, good to see you.
Thanks. So really interesting talk. So we're doing something similar, but in a Swedish context, trying to understand how to shape modeling in order to have an effect on policy. But so I was wondering, you mentioned uncertainty at some point, and I was wondering if you could say something about how to what was said during that workshop about communication of uncertainty, in particular structural uncertainty, which I think is a really difficult but important topic when it comes to modeling for policy.
Yeah, I mean, the way SPI-M, I suppose, addressed structural uncertainty was they had quite, and I think this was a real advantage of the way the chairs operated, is they allowed quite a lot of freedom for the different academic groups to develop models in their own way. So they weren't too specific, like it's got to be a compartmental model and we need them all to be the same. So allowing that variability, kind of natural variability that comes about when different people think about different problems, kind of incorporated that naturally. I know you've got the ECDC modelling hub, and that does something similar, that you're kind of, I mean, it's almost impossible, isn't it, for one group or one team to explore the whole range of structural uncertainty themselves, but having multiple different inputs does allow you to do that. I think then it comes down to communicating that, which is basically, I don't have an answer. It is really tricky. I was working with Andrew Conlon, who's a fantastic modeler in Cambridge, and he did some work on bovine TB, looking at two alternative models. Both fit the data really well, and they essentially came to opposite conclusions. And then you're kind of stuck, and you think, how do I, what do we do about that? But I think you have to, as a modeler, it's even more impossible for non-experts to interpret that. So you have to do your best at interpreting it for people and tell people how you should take that uncertainty. I basically haven't answered your question, but I think it's something, yeah, I don't know. Yeah, and I do think that I'm a big proponent of not including these mean lines, not including single epidemic trajectories at all. Don't even bother, because once it's there, it's almost impossible for people to not act upon.
Okay, thanks.
We have a question in the chat. I don't know if you can see. Ellen Simo-Pekka asks, did you use the contact matrix from the surveys directly, or did you first adjust them with the observed COVID-19 cases?
We use them. We first adjust them with it. No, so we use them directly. So we were using. They were adjusted for the representativeness according to the UK population, but we didn't. Yeah, are you talking about in the early stage, maybe people with higher numbers of contacts are more likely to be infected? We didn't do any of that adjustment. So yeah, it was kind of from the surveys directly adjusted for the underlying demographics. Great. And I'm very happy, by the way, if anybody, I mean, Philip, we're kind of actively talking about these things and shaping a paper at the moment to discuss these aspects. If you are interested in continuing the conversation, that would be absolutely great. We would be really open to that.
Yeah, that would be really interesting. Yeah.
Are you in contact with the people from the Lancet Commission working on evaluation of modeling studies for policy?
No.
That would be, yeah, we can. We did it. I met with Philip at a workshop on precisely that last week in Berlin.
Oh, right. Maybe. Very interesting.
Yeah. I was wondering, from the 6 points that you mentioned toward the end, you talked about the importance of building your relationships with public health policy advisors outside crisis time. What's been your experience, after the COVID-19 pandemic? To what extent have you been able to continue working in close relationship with policymakers?
Yeah, I mean, different policy teams now see the value, or maybe they did before, but increasingly see the value of having those relationships. And our collaboration with the Cabinet Office is precisely doing that. But I mean, it's difficult for them because they have competing priorities, and maintaining that relationship takes time and effort. And there's a turnover in government that you don't necessarily get in academia. And once you build up a relationship with someone, they then move off to somewhere else, and you've got to start again from scratch. So that was one of our motivations for getting these principles down and getting some insights from people who'd been involved during the pandemic, because when they're not involved anymore, you don't want the expertise just to go when the person goes. It would be better if there were some general principles that other people can then pick up and use. So ideally, it would be person free. That's kind of where we were going towards.
Yeah. Any other questions from the audience?
Yeah, if I could jump in. Yeah. Yep. Hi, Alan. Mike Runge. I'm on the coordinating team for the U.S. COVID Scenario Modeling Hub. So we've been thinking about a lot of the same things. I really appreciated your comments about the relationship building and the communication, and the overall theme you had that, like, if you wanted to be doing policy relevant science, that's different than just doing science, right? That's a different perspective. I wonder if you could comment, you alluded to it a little bit, but the questions you choose to study might indeed be different, right? If you're trying to answer specific policy questions. And so I'm curious about your insights about how you identify what those relevant questions are to policymakers to shape the very science that you're doing in the first place.
Yeah, that's a great question. And I think that comes from getting to know people and sitting in the same place. I mean, some of the questions come out of the fact that you are just trying to work out what you kind of go through an iterative process, and you suggest stuff and they say, oh no, I don't think so, and then you kind of go through that iteration. But working in isolation is, obviously makes it more difficult to answer the right questions, or answer the questions that might be right. Having said that, I also think sometimes we had experience that, with these researcher-led contributions, you could contribute something that hadn't necessarily been thought of by policymakers, just because they don't necessarily know what models can do. So, I'm sure everyone's been asked, like, oh, can you tell us what the impact of closing hairdressers are, or, something that you're just unable to answer with the type of models that you've got. So you have to go through that iterative process, saying, no, we can't say anything about hairdressers, but we could possibly say something about these other types of contacts.
Thank you.
Great, thanks.
Leah?
Hi, I'm Ellen. Thank you for this really, really interesting talk. I was just wondering, what's your opinion on, are we now better prepared for the next pandemic, having invested all these efforts into the modeling, or are we more or less back to square zero in case the next pandemic hits us in several years? Thank you.
Thanks. Well, I'd be interested to hear your response to that. I think we are in a better position because we have this collective knowledge of working together, and certainly our experience is, and we're trying to build on these connections that we didn't necessarily have. Sometimes it can feel a bit like a bottleneck, like there's one person that in a particular team, and all information has to flow through them. And I think one thing that worked really well during the pandemic was there was a bit of a democratization of information flow. So junior people were working with junior people, junior academics were working with junior people in government, and it was those many connections between modelers and civil servants that was really powerful. And not always having to go through one top professor who's in contact with the head of department in blah is really beneficial, and I would hope that would continue. So I think it's really important. We've been discussing, and we discussed during this workshop, things like having placements for PhD students in government departments, because those conversations that you have while you're having a cup of tea are really essential for creating those networks. So it needs to be a complex network of interactions between scientists and civil servants, not just a few high-level contacts.
Right. We are slightly over time, but it's a very, very interesting discussion. So I don't know if there are any other questions. We can do one more, maybe. If not, we can wrap up there. So once again, thank you very, very much, Ellen, for coming to talk today.
Thanks for inviting me. Thanks for the questions.
Yeah. Cheers. And good evening to everyone. Thank you for joining.